Good morning, everybody. My name is Sadhika Wadhwa, and my group partner's name is Krishnali Ravi. Our topic for the presentation is PCOS. The reason why we chose this topic for our presentation was that we both are from a medical background. We observed that more than 50% of women suffer from PCOS, and we found this very intriguing. Hence, we present to you our presentation on PCOS. So our presentation is going to include introduction, clinical manifestation and diagnosis, nutritional interventions, conclusion, and references. To begin with, introduction, what PCOD or PCOS is. So, it is a disorder which is subsequently rising in obese women either of reproductive age, and not only that, it is also predominantly visible in early reproductive ages and later menopause stages. It is a condition in which level of androgen rise insignificantly following an irregular menstruation cycle. So, tiny cysts start to develop in either one or both the ovaries, which leads to a negative impact on women's reproductive health. It also affects the menstruation cycle. It is the most prevalent condition affecting 5 to 10% of the women, especially of reproductive age, being a major cause of infertility. Hyperandrogenism. So it is a name along with an anovulation are some of the usual symptoms which will define PCOS. It is prevalent in 4% to 21% of women. When the androgen levels exceed a certain amount, it is referred to as hyperandrogenism. So what is hyperandrogenism? Hyperandrogenic refers to the presence of excessive levels of androgen hormone. Typically, androgens are associated with male hormones, like testosterone, but some amount of androgen is also found in women too. In actuality, since there is only one enzyme step separating the creation of androgen hormones from that of female hormones, which is estrogen, women must create androgen hormones, estrogens. Ovaries of women with PCOS frequently produce slightly increased levels of androgens. Women who have even mildly increased amount of androgens in their body may see a decrease in the number of mature follicles, and the tiny cysts in the developing follicles attempt to develop properly, but are prevented from doing so if too much androgen is present. Undeveloped follicles start developing in ovaries, giving them a polycystic look. With time, androgen levels and anovulation gets worsened. Insulin resistance, hyperinsulinemia, along with obesity, the three main components of metabolic syndrome, which also contributes to the cause of infertility, are additional traits that are usually present in polycystic ovary syndrome. PCOS in women is a co-marker for obesity and overweight. Nowadays, because of obesity and overweight, women are suffering more because of PCOD and PCOS. Despite the fact that many women have PCOD, are overweight, many lean women also experience certain changes like type 2 diabetes and cardiovascular diseases. So it is not only the case with obesity. Obesity do links to PCOD and PCOS, but nowadays, as we have said, that lean women, they also can experience PCOD and PCOS because of certain lifestyle changes which lead to it, because our eating habits have changed, our lifestyle has become sedentary. So that can also be a reason for PCOD or PCOS to occur in lean women. The constitution of a PCOS affected woman is dependent on two factors, basically hyperandrogenic and hyperinsulinemic conditions. They contribute to existence of obesity. In fact, they are the main promoters of obesity, particularly in the abdominal region, because abdominal region in a woman is more prone to obesity and more prone to visceral fats. Lifestyle changes, which include dietary habits as well as increased physical activity, should be the main goal of women suffering from PCOD. Diet, along with workouts and reducing weight minimally by 5 to 10%, should be the primary motive, which contributes to decreasing testosterone levels and improving the functions of ovaries. Now coming to BMI, which is body mass index, body fat, and waist circumferences. These are the three indicators if there is a lack of insulin. Monitoring the diet, like balancing carbohydrates intake, keeping a check of meal frequency, including foods rich in omega-3 fatty acids, and keeping up the vitamin D supplements help reduce such risks. Now talking about the clinical manifestations and diagnosis. Like other complicated heterogeneous disorders, the etiology of polycystic ovary syndrome is unknown. However, both environmental and genetic factors are thought to be involved. With passing years and the development of new technologies, attention has switched from the ovary to hypothalamic pituitary axis and finally to some pathological deficiencies of insulin activity as the major cause of illness. There is a very strong evidence linking all of these causes, and because they interact to control ovarian function, it is likely that different underlying abnormalities could have the same adverse effect. Talking about obesity significantly affects how polycystic ovarian syndrome manifests. Like in women with condition, being overweight worsens metabolic and reproductive problems, and family studies indicate that being overweight may help to spread the polycystic ovary syndrome phenotype in a population that is predisposed to it. So all of these things basically basically say that polycystic ovarian syndrome is because majorly due to obesity and overweight, and hence the changes in diet should be the major goal. Lifestyle adaptations should be the major goal. Although the extent of the increase relies on the frequency of obesity in the population, there are clear racial influences on the prevalence of reduced glucose tolerance, diabetes mellitus in polycystic ovarian syndrome women. There are certain risks of cardiovascular diseases like hyperlipidemia or CVD in people with PCOD. Not only that, nowadays people having PCOD does not only suffer from weight gain or menstrual cycle issues. They also suffer from glucose intolerances. They also suffer from diabetes mellitus. They also suffer from various other disorders, heart diseases, heart issues, because obesity somehow is linked to various kind of heart diseases as well. And if person is tend to be obese, then there are certain other issues which accompany them, like it is going to be various issues like polycystic ovarian disease, and apart from that there are issues like racial influences, reduced glucose tolerances. So glucose tolerances turns out to be abnormal for women with polycystic ovary disease, and they are likely to get diabetes in near future. According to stats, it is very clear that in near future the people suffering from polycystic ovary disease are hence also suffering from diabetes as well. So I end my part here, and further the presentation will be continued by my partner Krishnali Ravi. Thank you.
Good morning, everyone. I will be taking the presentation forward from here. Thank you, Sadhika, for the informative points that you told us. So basically, I would be explaining the diagram over here firstly. We can see in the first figure that on the left hand side there is a normal ovary, and on the right hand side there is a polycystic ovary consisting of small cysts. So basically, if the ovaries are normal, the hormonal fluctuations are also normal, and this gets steep during the duration of between the 12th and the 16th day of the menstrual cycle. Talking about the two hormones that we can see, LH and FSH, saying the luteinizing hormone and follicle stimulating hormone. So in PCOS, as we can see, there are 4 major symptoms, being acne, irregular menses, hair growth, and ovulation and infertility. Due to this, the hormonal changes are to an extent that the steep present in the normal menstrual cycle is not present in a PCOS cycle as seen in the final figure. So the figure clearly illustrates the difference between a healthy ovary and of a polycystic ovary. And in the final figure, we can also see that the constant higher LH means there is no surge of LH to trigger ovulation. Due to this, there is a cascading negative effect leading to imbalances of the estrogen and progesterone, which in the end leads to the symptoms that we discussed before. Moving forward, the nutritional concerns of a polycystic ovarian syndrome. The first is aim of nutritional interventions in the treatment of PCOS. The objective of nutritional interventions is to achieve a balance of all the nutrients and to produce the energy required by the body. These interventions help maintain a healthy nutritional output and help avoid diet-related complications in the body. Nutritional interventions help improve decreasing insulin resistance through a lower interval dietary recommendation. Women who are on the bulkier side aim on reducing their body mass, as by doing so their menstrual cycles get normal and eventually bring down the PCOS symptoms. Through a long period dietary recommendation, say for months or years, the main aim is to reduce weight to an extent to reduce risks of many health concerns which comes with PCOS, like hypertension, diabetes, cholesterol, and many heart-related diseases. Apart from this, women who suffer from PCOS and who consume the recommended diet experience low infertility in general. Adding protein to the diet directly helps in bringing the body mass down and also faster the metabolism in women. Implementing higher protein meals could also have possibly adverse effects, like it can affect the kidneys. To maintain a balance and avoid accumulation of protein, it is balanced by decreasing the amount of fiber in the diet. So basically, by concluding this, the protein is necessary but not in an excessive amount. Consuming micronutrient supplements have a positive effect on some level when it comes to PCOS. For example, consuming 220 milligrams of zinc sulfate per day for 8 weeks has positive effects on insulin resistance and fasting glucose. Apart from this, consuming other supplements like folate, selenium, chromium, etc. also have positive effects on PCOS. So the conclusion of the entire presentation that we presented today is that through this presentation, we can well demonstrate PCOD. Factors such as an ovulation and high levels of androgen is prevalent. It is experienced usually in reproductive females and sometimes even after menopause. The ovaries develop cysts and disrupt the menstrual functioning, which shows and affects our body parts like increased facial hair and the other symptoms that we discussed before. Diet and exercise are very important lifestyle changes and important for women having PCOD. Studies indicated that obese women were at higher risk of having PCOD. Diet should be rich in protein and other diet balance should also be well maintained. Diet should have vitamin D balanced well. These measures and steps, if taken properly, can help control the disease. And in the last slide, we have included all the references that we have taken to create the PPT, and we have followed the APA formatting, and the references are as follows in the points. Thank you so much and have a nice day.